Now we're going to go over how to perform and set up the meeting as the scribe. Now, after you create the meeting, you're going to want to immediately sign up the proper team members for each patient. You're going to want your entire core IDG team, that is the MD. The MD is already assigned to each patient who is showing up to the meeting. So in this case, it's the Dr. Farrell. But other than that, we need three team members. We need an RN, we need a social worker, and a chaplain. Even if the social worker might be declined or the chaplain might be declined as a discipline following that patient and performing a patient frequency, you'd want to have someone selected who would be signing on behalf for that patient in the IDG meeting. That shows you had all four of the main team members there ready for the discussion and ready to sign, and they can add notes and on the patient or discuss the patient if there's any questions. Um, Now, to assign those team members, we're going to click this silhouette button icon, and if you hover over that, it says Assign IDG Members, and that's exactly what we're going to do. By default, it will pre-select the team member who's assigned, say, as the case manager for the RN or the social worker or the chaplain. Now, so on this first patient, we see everything is selected. We have an MSW, we have Betty, the RN, we have Lee, who's the chaplain, and everyone has, again, that medical director who's showing up to the meeting. So this one's all good. I don't have to do anything. Unless, say, Betty is not showing up to the meeting, I'd want to, select someone else who will be showing up to the meeting. Okay? And so you just make your edits and hit save on the individual patient. Now this one is missing, so definitely we'd want to select that case manager who we know is going to be showing up. And also you'd want to think, okay, to fix this for next time, you'd want to assign that team member to the patient's profile. So you'd want to be able to set up a certain RN as the primary case manager for this patient under the team tab on the patient's profile. We won't go over how to do that in this video. We'll do that in another video. But just know that's what you should be looking for. If you see these empty slots, think about setting up the team members from the patient's profile. Now let's go ahead and select Betty RN because we know she's the case manager for this patient, and we'll do the same for the next one. Now, let's go on one of these who might be missing a chaplain. You might be missing a chaplain. Let's say this patient has declined chaplain services. That's okay. Let's go ahead and select Lee, who's going to be visiting, the IDG meeting, and an MSW. Maybe the MSW is also declined for this patient. Let's select them because we're saying they're present. They were there during the discussion, and they'll be able to sign on the IDG meeting for this patient, and we'll hit save. So you're going to want to look for those blank items. Now, bereavement, you'd really only select that for a patient who's recently deceased. That would be a good idea. You do not need bereavement selected on each patient in your IDG meeting. Also, a volunteer coordinator. You don't need a volunteer coordinator selected. That's just in case you guys want that. But so mainly we're focused on the four core disciplines for the IDG team. Those people all need to discuss and sign for the patient. Okay, you want to go through the entire list, make sure everything looks good, and then you can click back to meeting list. What that does is it also allows those team members to be able to sign and put notes for each of these patients before they show up to the meeting. So it's crucial that you set up this meeting 1 or 2 days in advance, and also right away when you set up this meeting in Hospice Engine, you select the correct team members, and that gets them set up so they can be successful and on time before your meeting starts. Other than that, as the scribe, your next part is to be there during the meeting. You'd want to have a laptop or a TV screen ready so you could be able to show the patients who you'd be discussing. during the meeting. You can reference data for each of these patients during your meeting. So you'll be referencing the information, or you could reference the information for these patients. Now, each patient is brought into the IDG meeting for a reason. They're all brought in just because they're either active patients or some event is happening or has happened, and we show you the reasons on the right-hand side. Okay, some of those reasons are listed here. Either they're a new admission, they have a level of care that's non-routine, their research coming up, or they got discharged, or they've recently revoked, or they're one of the nurse's patients. Now, there's a couple other reasons too. The red flags. Red flags, we call red flags patients who are full code, or if we don't know the DNR status in Hospice Engine, we'll label them as red flags. So that's something that would need to change or be everyone would need to be very aware that they're full code, or we don't know if they're full code or DNR. Something hasn't been discussed or decided with that family. Okay, and those are the reasons we're going to discuss the patients. Now, you can choose to discuss the list of patients in any way you'd like. You can follow alphabetical order, or in some cases, you might follow each case manager. So you might say, okay, we're going to talk about Janet's patients first, and then go on to the next case manager. Okay, in that case, as the scribe, you can search for the case manager. So let's say we're looking for Wagner. We could type in the second filter. It says search for case manager. I could type in Wagner, and I'm just seeing Wagner's patients. And then we could go through and discuss those patients. Okay. Or you can just let the conversation happen while the IDG meeting is rolling, and then if you're the scribe and you're just kind of acting like a fly on the wall, you're you're there to help out potentially. You can just select the patient that they happen to be talking about. Okay, it will load up the information. Now, a key item is that after your discussion, you need to click this button here saying mark discussed. That allows the team to sign for this IDG meeting after the meeting occurs. Okay. And it gives you a checklist saying, okay, this patient we discussed and these other 25 patients we haven't. And it shows you a list that keeps getting shorter and shorter and shorter until you get to the one or two patients you haven't talked about yet. Okay. Now, as the scribe, you can put notes here. Say there's something critical that's happening with the patient and you just need to jot something down. This will appear on your IDG printed note. So just bear that in mind. This narrative field isn't used all that often, but it's there in case you need it as the scribe. Okay. Typically, what will happen is the conversations will occur, the doctor will give instructions to the RN, and the RN will go ahead and perform whatever changes need to happen with the patient's plan of care. But if you, as the scribe, need to write something down, you can do it there. Now, around here, we have data items. So if you click the title, it will open up. Now, in this section, you'll see the recent narratives from the nursing forms and the social worker forms and the chaplain forms. And you'll also see any narratives given by the team members before the meeting started. Okay, so all those will be saved here. Now, also you can see the patient's current frequency. You can see their key training measurements. Now, key training measurements, we're not seeing anything here because this is just a demo patient, but we follow key metrics of what changes are happening, like the FAST scale, their pain level, and a few other things. They'll show here of to give you any changes in the last 14 days or 15 days, and it'll show you kind of what's happening with the patient currently. IDG plan of care review. This is showing you what changes occurred to the plan of care. Since this is demo data, we're not seeing any changes. You can open up and see the entire plan of care. You can see the secondary diags. You can go look at the pharmacy changes in the last 14 days or all the medications. You can click here to see the non-medication orders like wound treatment orders, DME orders, diet orders, level of care orders, things like that. And then you can see the skin assessments, what changed in the last 15 days, and then their recent on-call visit history in the last 15 days. Okay, so these are just data items. You can reference them if, say, anyone has a question during the meeting. It's a good resource. Okay, once you're done talking about this patient, you would click Mark Discussed. Okay, and then you would just go back to your meeting. You can close this tab. It opens up in a new tab here. And if I reload the list, you're going to see that this patient's status has changed. Now it says that Mary Cotta was discussed. Okay. And at the top, you can filter with these buttons. You could select, okay, I want to look at the undiscussed patients. And then, like we said, that list will get shorter and shorter. Or you can filter by the discussed patients and see who you already talked about. And that's kind of how to navigate as the scribe in your IDG meeting.